and welcome back to another episode of MedSynapse podcast series. I'm your host, Hetvi Shah, and today we are diving into a topic that deserves far more spotlight than it gets, which is men's health. While women's health rightfully sees awareness campaigns and policies, men's health issues often stay underaddressed, especially in areas like fertility, hormonal health, and prostate care. And joining us to unpack this is Dr. Krishna Mohan, Senior Consultant Urologist, Andrologist, and Men's Health Specialist at PSD Hospitals in Coimbatore. With years of clinical experience and a commitment to reshaping the men's health landscape in India, Dr. Krishna brings both insight and urgency to this discussion. So, welcome to the show, and it is such a pleasure to have this discussion with you, Doctor.
Thank the organizers of this podcast for selecting such a raging topic in India in healthcare, that is men's health and andrological care.
So, to begin with, we often hear about women's health campaigns, but men's health remains surprisingly underaddressed. So, from your perspective as a urologist, what are the most overlooked or misunderstood aspects of men's health in India?
So, men's health deals with a wide variety of diseases affecting exclusively men. That is right from prostate problems to urological problems to male sexual dysfunction and male infertility. So, why is this important? So, everyone would have seen a lot of women's health care and pregnancy care, etc. But nowhere there is an exclusive like a men's health clinic, especially in India. But in abroad, Western countries, there are a lot of importance given to men's health recently. So why is it important in India? So men are considered as the earning breadwinners of the family. So in cities it is improving, but still in rural areas, so men are considered as the breadwinners. And when the men face health issues, then the entire family faces financial stress and other issues. So men's health is very relevant in India, especially men's health issues, because it's still a taboo in India. So when a man has men's health issues, he's very reluctant to come forward and get treated. That is because he thinks that if he is diagnosed with any men's health issue, then the entire society will look down on him and discriminate him. So slowly the awareness is increasing, and people and men are getting more aware and they are coming forward to get treated. So why men's health? So it is a neglected part of healthcare in India, and there should be more infrastructure to correctly evaluate these patients, more specialists like me to evaluate such men's health issues and treat them properly.
Yes, I think that's a powerful point, Doctor. And now moving on to the next question. You have managed diverse andrology cases over the years. So, are there any patterns you have noticed, whether it's age group, lifestyle factors, or comorbidities that make Indian men particularly vulnerable?
So, basic problem is the younger generation today. They lead a westernized, sedentary lifestyle, mostly work in the offices, 9-to-5 jobs, sit in front of the computer system, and then they do not have the sufficient amount of exercise to make them fit and stay healthy. So what happens is, these are the most common age group, like maybe 20 to 40s, that face the most common amount of men's health issues, and they become distressed. And also India is the capital in the world for diabetes. So these sedentary lifestyle and westernized food and junk food has increased obesity and metabolic diseases in our country, especially diabetes. So diabetes leads on to early occurrence of men's health issues, especially hormonal imbalances, sexual dysfunction, and erectile dysfunction. So this is why the Indian men, especially the younger men in their 30s and also 40s, experience a increased incidence of men's health issues today.
Yeah, actually, absolutely that your observation on early intervention really resonates well, doctor. So now, doctor, India still lacks standardized national screening programs for things like prostate health, testosterone levels, or even fertility evaluation for that matter. So, what policy level interventions do you think are long overdue?
Basically in India, there's no proper infrastructure or proper protocols to, or SOP, standardized operating protocols for managing andrological patients or men's health issues. So the basic step in order to streamline this would be establish SOPs. So slowly the andrological care is becoming better. More and more andrology specialists are getting trained and started practicing. So slowly this entire care would become more streamlined in the future. And so basically the initial level, grassroots levels, there needs to be some training to the grassroots level doctors handling these patients to treat basic cases and also to refer advanced complicated issues to respective urologists and andrologists to treat the patients better. So in India, there is no, for men's health, there is no screening as such, no screening government programs as such. In private sector also, there's no screening, but slowly the master health checkups and other yearly checkups are bringing in prostate health, health checkups and all those things. So prostate is one of the most men-related issues, especially in India. So prostate cancer screening has not picked up in a big way like Western countries in India. So that also has to be brought into the standardized annual health checkup. And especially the PSA should be done in all patients above 60, all men above 60, and also high risk men with a family history of prostate cancer should get it done above 45 years. And also there should be some amount of screening for hormonal disorders as well as infertility at the grassroots levels. So that also has to be implemented. And slowly we are bringing this into the SOPs, and in the future, maybe within 4 to 5 years, this would be possible in India. And also in the even physicians and other doctors, other specialty doctors are becoming more aware about this specialty, and slowly as the awareness improves, people are coming forward, and also the fellow doctors or colleagues are also referring patients for getting a proper andrology care.
Yeah, I think that's so well articulated in all, doctor. So thank you for sharing that. Now, doctor, let's talk about progress. How has the field of andrology evolved in the last decade, and are there any breakthrough diagnostics or therapies that you believe could revolutionize men's healthcare in India?
The field of men's health and andrology has improved leaps and bounds in the last decade. So previously, maybe a decade back, a patient with zero sperm in the semen would have had no option but to adopt a child. But now with the recent advances of in vitro fertilization, IVF and artificial reproductive techniques, and advanced microscopic procedures like testicular sperm extraction and various advanced sperm retrieval techniques and IVF techniques, patients with, males with even a zero sperm are able to have babies and children. So that is how advanced it is right now. And also for the sexual dysfunctions also, treatments have become advanced. Previously untreatable sexual dysfunctions are now treatable and patients are curable and lead a normal sexual life. And also in the diagnostics part, the artificial intelligence is coming up in a big way, especially in semen analysis. Which artificial intelligence are able to process a lot of data immediately and give us a accurate prediction about successful pregnancies. This helps us in a great way to counsel the patients, the couple, and also the couple is very happy because they are able to get results faster using artificial intelligence. So this is how this field of andrology is improving leaps and bounds in the recent days due to advancements in techniques and also incorporation of machine learning and artificial intelligence into andrology.
Yeah, I think the possibilities that you have highlighted are truly exciting, doctor, and I think everybody should look forward to that, and it's really important to address men's health. So, doctor, now lastly, for our listeners, many of whom are healthcare professionals, what message would you like to leave about how we can collectively reshape the narrative around men's health?
So what I would like to say to my fellow colleagues and doctors is, men's health is not just an andrologist's responsibility, it is a collective responsibility. So not all patients with men's health would come to us directly to an andrologist. So they will first initially approach a physician maybe, or a grassroots level primary health care worker or a doctor. And it is imperative that these primary care level physicians or doctors to correctly identify, evaluate and diagnose patients with men with men's health issues and treat them accordingly. So basic level andrological care, if the doctors or the care worker is trained enough, they can handle. Or if they find it is a very complicated or advanced, then they can refer directly to an andrologist or an urologist in order so that the patients can get a proper andrological or men's health care. So men's health is a wide spectrum. So the awareness we are creating using YouTube videos as well as social media as well as several conferences and also events to make the fellow doctors and also urologists more aware about the andrological care as well as men's health issues treatment, so that the patient and men in India with men's health issues can have a smooth evaluation, diagnosis of their men's health issues and also a proper treatment, so that we can bring a smile to the faces of the men in India.
Yeah, I think that's a powerful message, doctor, for all the healthcare professionals. So, doctor, as we wrap up today's session, thank you for addressing men's health, which is not just about treating symptoms, it's actually about building a culture that prioritizes prevention, conversation, and care. So thank you so much for being a part of this podcast today, doctor.
Thank you.
And to our listeners, thank you for tuning into this episode. And remember, if you're a healthcare professional who's eager to delve deeper into medical topics or have questions, do not hesitate to join us on the MedSynapse platform. MedSynapse platform is not just a resource. It's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So until next time, stay informed and stay healthy.